Hi, it's me again. I'm just here to talk to you about having fibromyalgia and the effects it's had. Basically, I'll just talk briefly about it and go on and on through what they do and everything, and we'll take it from there. Signs and symptoms of fibromyalgia can vary depending on the weather, the stress, what you've been doing, or even the time of day. The pain associated with fibro is described as constant dull ache, which arises from the muscles. To be considered widespread, the pain must occur on both sides of your body, above and below your waist. Fibro is characterised by additional pain when firm pressure is applied to the specific areas called tender points. Again, it's a bit like having costochondritis. When you touch your ribs, the pain will continue. The best places to check where are tender are the back of your head, between your shoulders, the top of your shoulders, the front sides of your neck, the upper chest, outer elbows, upper hips, side of hips, and inner knees. It does cause a lot of tiredness, fatigue, and sleep disturbance, and people with fibro are often awake and tired, even though they seem to have had plenty of sleep. A bit like me. I can feel sleepy, but I can't sleep because I'm just uncomfortable. People believe that these people rarely reach the deep restorative stage of sleep. Sleep disorders linked to fibromyalgia are restless leg syndrome and sleep apnea. People also may have pre-existing conditions like chronic fatigue syndrome, depression, endometriosis, headache, irritable bowel syndrome, lupus, osteoarthritis, post-traumatic stress syndrome, restless leg syndrome, rheumatoid arthritis, and quite possibly conditions like I have, which are the psoriatic spondylitis and the costochondritis. The fibro I've only had for a few months, so the idea of it is still bearing on me. I'm not quite used to it yet. The causes, doctors don't know at all what causes this. However, they do have some theories, one being genetics. Fibromyalgia can run in the family, and that may be the reason why it's being passed on to other people in the family, which could be why people are susceptible to it. Infections, it's possible, like many other illnesses like arthritis, that these can be triggered by infections of some sort, and obviously this post-traumatic and emotional trauma, stress can easily affect many different things and start off many different things. To why it hurts, people think it's centred to do with your sensations. There is a theory that states people with fibro have a lower threshold for pain because of increased sensitivity to the brain in the brain to pain signals. It's believed that nerve stimulation causes the brain of people with fibromyalgia to change. The change involves an abnormal increase in levels of chemicals in the brain that signal pain. In addition, the brain pain's receptors seem to develop a sort of memory of the pain and become more sensitive, meaning that they can overreact to pain signals. Makes me sound lazy. Risk factors. Well, fibro occurs most often in women than it does men. It tends to develop during early and middle adulthood, but it can occur in children and older adults. It's unclear whether sleeping difficulties are the cause of fibromyalgia, but people with sleep disorders such as nighttime muscle spasms in the night, restless leg or sleep apnea often have fibromyalgia. And again, it could be to do with family history. A relative who already has it. And if you have a rheumatic disease such as rheumatoid arthritis or lupus, you are most likely to develop fibromyalgia. Even I didn't know that. Complications. The fibro isn't progressive and generally doesn't lead to other conditions or diseases. It can, however, lead to pain, depression and lack of sleep. These problems can interfere with the ability to function at home, at work and in your family and close relationships. It can be very frustrating and often misunderstood. Again, that's a bit like having arthritis. Because I actually look okay and dress okay, and you can't see the pain, people are quite often willing to judge me when they don't actually know what's going on. Preparing for an appointment and to go find out how you're going to be tested, because there's many symptoms of it and they can be very similar to other disorders, you may need to see several doctors before a diagnosis. Often a GP or rheumatologist will diagnose it. What you can do is write a list that includes the descriptions of your symptoms, information of medical problems in the past and present and in the family, all medications and dietary things you take, and any questions you need to ask. And what to expect from the doctor when you go is to be tested is your reflexes, your muscle strength, your muscle tone, your senses, touch, coordination and balance. Some of the tests to follow are quite different. Basically, I was suffering with tiredness and feeling very, very poorly, and I went to my GP and was tested in quite a different way. I was checked over from head to toe, basically, of how I can move, how I can bend, how I can straighten, and she checked every single bone in my body and she checked every single muscle and felt all the tender points. That was a rheumatologist. My GP was the one who actually first diagnosed it. So it does vary from person to person what will happen. For instance, here, this is another statistic I believe. The American College of Rheumatology has established 2 criteria for the diagnosis of fibromyalgia: widespread pain lasting more than 3 months and at least 11 out of 18 positive tender points. Tender points during your physical exam, your doctor may check specific places, where I said before, to see if there's any tenderness, and it depends on the amount of pressure there is through the examination. While there is no lab test to confirm the fibromyalgia, blood tests can be used to complete your blood count, and a thyroid test and anything else that may be able to shed some light on the condition. Treatments and drugs. Well, at the moment, the treatment I am on is just the pain relief for my arthritis, which is cocodamol and steroids. I'm also on diazepam as well, and zopiclone for a short period of time to see if it helps me sleep and relax my muscles. The medications that can be used are analgesics like tramadol, naproxen, ibuprofen, aspirin, things like that. Then there's antidepressants like fluoxetine, diazepam, things like I've been on to help you relax. And there may be other anti-seizure drugs that you may be able to help what they treat people with epilepsy and things. Physiotherapy is always a good balance to help with light exercise as well, and there's also counselling to help you live with the actual illness itself. Again, all these different things also stand to reason with the arthritis as well. In all these conditions, they ask you to try and reduce stress, they allow time for you to relax and have quiet time and not to get stressed out. They tell you to get some sleep, light exercise and to pace yourself so you can live to learn with these conditions. That so far is all I am aware about fibromyalgia, but when I do find any more information out, I will gladly let you all know.